In this video, I'm going to talk about movements of the hip. So open chain movements of the hip are very straightforward. They're just like the shoulder. So you have flexion extension in the sagittal plane, you have ab and adduction in the frontal plane, and you have internal and external rotation in the horizontal or transverse plane. One thing I want to point out is you'll notice that when you rotate your hip internally and externally, you'll notice that your toes move, right? So when you externally rotate, your toes tend to point out, and when you internally rotate, your toes are going to tend to point in. And that's a common way to reference it for patients. When you tell them for hip rotation, you might say, point your toes out or point your toes in, whether you're doing an exercise or position. And it's very helpful because it's easy for patients to follow, or even for regular people to follow. But it's important to realize that when you're moving your foot like that, you're really moving your hip, okay? This movement, you can move your foot a tiny bit in this plane, but only a tiny bit. And if you don't believe me, have someone hold your tibia and see how far you can move it. You can't. And when your knee is totally straight, there's no rotation at your tibia as well, okay? So actually, if you've got flexion at your knee, you can do a little bit of rotation, but when the knee is straight, okay, and I'm doing this movement, no matter what my foot is doing, it's just following my hip, okay? And that's very important to remember. So when people talk about in-toeing or pigeon-toeing, really that person is walking with internal rotation, and it's got nothing to do with their foot. So that's open chain movement of the hip. So we also can talk about closed chain movement of the hip, right? So in closed chain movements, the distal end is fixed, okay? And now instead of the femur moving on the pelvis is moving on the femur, right? Because muscles always have a choice. They can choose to mobilize one segment over the other. And typically the way you think about it is when we talk about origin insertion, you move the insertion or the more distal attachment towards the origin. So the femur towards or away from the pelvis, but you could also move the pelvis towards the femur. So for flexion and extension, closed chain flexion is just going to be this or this for extension. And one thing to note is when I do that movement, I'm also doing lumbar flexion and extension. In some cases, in some pathological cases, you can see where someone is doing more one than the other, but typically they're going to blend in together, okay? And you have a lot of flexion and extension in the lumbar spine. And that's called what Newman calls kind of a long arc movement. You can also have a short arc movement, and that's an anterior and posterior tilt, which we talked about before. So an anterior tilt is basically kind of the top of my pelvis kind of rolling forward in the sagittal plane. And you'll notice that when I do that, I kind of stick my butt out a little bit, stick my belly out a little bit, and you'll notice that the lordosis in my back, this kind of extension part, actually gets larger. Okay, versus just a regular neutral position, right? Anterior tilt, it's kind of a roll forward, and you have an increase in lordosis, okay? And that's actually created, there's a force couple. You have your hip flexors on one side can pull your pelvis down, and or your your back extensors can pull up on your pelvis from the other side. So that's anterior tilt. It's considered flexion and extension, but kind of a small arc as opposed to a long arc. Posterior tilt is the opposite, right? It's going to be your kind of this upper part of your pelvis kind of rolling back, all right? So you'll notice now what happens to my low back, that lordosis kind of goes away, becomes more straight, okay? And this is basically extension. So any muscle that extends the hip can pull down on your pelvis and do a posterior tilt, or your abdominal muscles over on the anterior side can pull up and move that pelvis back. Okay, so anterior tilt coming forward, basically a form of flexion. Posterior tilt going backwards, basically a form of hip extension, but a short arc. Ab and adduction, open chain is pretty straightforward. ABD moving away from the midline of the frontal plane, and then ADD moving towards the midline of the frontal plane. So that's open chain. Closed chain is when the pelvis is moving towards the femur on the frontal plane. So the first thing to recognize is when I'm just standing on both my feet, okay, what holds my pelvis up in the frontal plane? Well, it's just my femurs, right? My femurs on top of my tibia. I've got bilateral support, so my pelvis basically just kind of sits on my, you might say, just kind of hangs out on top of the lower extremities. And this is a very simple model of what that would be, right? If you think of this block as being my pelvis, and then these two bones as being kind of my lower extremities, okay? Same idea. So these blocks are holding up my pelvis. Just in the same way when I'm standing, right, my extremities hold up my pelvis. But what happens when I go to a one-legged stance? Okay, now that support is gone. So if I just take away a block, okay, if I just take away a block, what happens? Okay, my pelvis falls down, okay? Now when I do this, my pelvis doesn't fall down, right? It stays up. Why does it stay up? Okay, it stays up because of my hip abductors on the opposite side. Okay, so muscles always have a choice. Okay, so when I do this activity, okay, my abductors, and they're right here on the lateral side of your hip, they're very easy to feel, your gluteus medius. When they shorten, right, they're going to pull the femur away from the midline, okay, and do this. But what if I had my weight on that leg? Okay, what if they pulled the pelvis towards the femur? Okay, then they're going to hold that pelvis up. Okay, so then now when I move this leg, I have my abductors on this side holding my pelvis down and not letting it dip. So they don't so much lift it up as kind of hold it level, which I think is what makes it a little bit confusing. And if you don't believe me, do this exercise. Okay, in this exercise I'm doing open chain abduction on my one leg, but I'm doing closed chain abduction on my other leg because it's holding my pelvis up. And you'll notice right around 10 or 12 repetitions, you'll really start to feel it on which leg? This leg. Okay, and you'll probably even feel it right in here. And that's because while this abductor muscle is mobilizing my femur, which is X amount of pounds, this hip abductor muscle is holding up my whole body, right? It's holding up all my weight plus all the forces involved. So it's actually working much harder. And you'll notice in any one-legged stance when you're moving one leg, it's the leg that's holding you up that you're really going to feel. And it's your hip abductors that are primarily holding it up. So just to demonstrate kind of with the model, right? So if you imagine kind of my strings here as being my abductor muscles right on the side, okay? Like I said, if I don't have anything going on the opposite side when I go to lift this leg, my pelvis drops, okay? So in real life that would look like this, okay? I pick up my leg and I drop. And in fact, in cases of extreme weakness, people do collapse if they've got absolutely no hip abductor strength, okay? So it drops, okay? My leg, this leg moves and it drops. But if it doesn't drop, what's happening? Well, if you can imagine this string on this opposite side, right? If it pulls down, okay, if it's pulling the pelvis towards the femur, when I lift this leg up, it stays up. Okay, I'm pulling on this string, okay, which is exactly what your muscle, it just fell on me. But if you can imagine this string, this muscle, pulling down, holding this down, then when I lift this leg up, this pelvis will stay stable. But if it's not there, and I move this, it's going to drop. But notice, where does it drop? Okay, it drops on this side. This is the muscle I want active. So it's always going to drop on the opposite side. Okay, it's always going to drop on the opposite side. Okay, because it's a leg on the ground that's got to do the stabilization. Okay, so if I drop here, I'm weak on this side. If I drop here, right? If I drop here, I'm weak on this side. It's always got to be the leg that's on the ground that's got to do the stabilization, all right? This is commonly called a Trendelenburg sign when you have this hip drop, okay? And when we talk about gait, we'll talk about Trendelenburg gait when you have that drop on that opposite side. But whenever you have, so the key point is that you have closed chain abduction. That's generally used to stabilize the pelvis when the other leg is in the air. Okay, so it's the opposite side hip abductors that are stabilizing it. And that's something we'll come back to again when we talk a lot about gait. So the last thing I want to touch on is closed chain internal and external rotation. So internal rotation is just the toes kind of moving in, right? And your internal rotators, they basically come from kind of your pubis area and kind of the inferior part of the pelvis, and they're going to attach on the medial side of your femur and the posterior side of the femur, so they kind of come in here. So when they shorten, right, they're going to pull your toes in, and that's open chain. But what if the weight is on my foot, okay, and they pull in? How am I going to move? It's actually going to rotate, right, because the pelvis is a unit, right? So if I move one side, I move the other side. So my right internal, I'm doing closed chain, right internal rotation. You'll notice that the left side of my pelvis is moving towards the right. So it's kind of rotating towards the same side, okay, for closed chain internal rotation. What about external rotation? Well, you've got a group of external rotators